$26,993. Picture the envelope in the mailbox, the flap torn open at the kitchen table, the eyes skipping straight past the logo, and the fine print to the number circled in bold at the bottom. That's it. That's what the average American family paid for employer health insurance in 2025. More than the price of a brand new Toyota Corolla, every single year, just for the right to have coverage. Workers themselves cover about $6,850 of that out of their own paychecks, before their employer picks up the rest. And even after paying it, the average deductible before coverage even kicks in runs close to $1,900. For workers on single coverage, nearly three-quarters face an out-of-pocket maximum above $3,000 on top of everything they've already paid in, and 1 in 5 face a cap north of $6,000. That's the price of admission. And when insured Americans actually try to use the coverage they've been paying into all year, nearly 1 in 5 say their insurance denied a claim in the past year. Not because a doctor said no, not because the treatment didn't work, because somewhere inside an insurance company, a form got stamped "not covered," and statistically, almost nobody who receives that stamp ever finds out why, or pushes back. Here's the part that doesn't add up. If you looked only at the numbers, you'd think health insurers were barely surviving. United Health Group, the single largest health insurer in the country, brought in $447.6 billion in revenue in 2025. Their profit on all of that? $12.1 billion, actually down from $14.4 billion the year before, their lowest profit since 2018, after Medicare funding cuts, rising medical costs, and the fallout from a major cyber attack. Do the math on that and you get a margin of 2.7%. That's thinner than most grocery stores run. And United Health wasn't even having the worst year in the industry. Across the 6 biggest health insurers in the country, every single one turned a profit in 2025, except one, which lost nearly $6.7 billion navigating Medicaid and marketplace turmoil. So if the margins in this industry are supposedly this thin, why is health insurance still one of the most profitable sectors in America? Why does a 2.7% margin still translate into a company worth hundreds of billions of dollars? And why do executives running these companies take home tens of millions of dollars a year, while your claim gets rejected for lack of prior authorization? A thin percentage margin sounds reassuring, right up until you remember it's a thin slice of one of the largest revenue numbers in the entire American economy. Something isn't adding up, and once you understand how this business actually works, you will never look at a denial letter the same way again. Here's the one-line version. Health insurance doesn't make its real money by paying your claims well. It makes its money by controlling exactly how much of your premium is ever legally required to leave the building. And the system is quietly built so that number keeps rising no matter what happens to your care. Start with the rule that's supposed to protect you. Under the Affordable Care Act, insurers are bound by something called the medical loss ratio, or the 80/20 rule. On the individual and small group market, an insurer has to spend at least 80 cents of every premium dollar on actual medical care and quality improvement. On large group plans, the kind most of us get through an employer, that bar rises to 85 cents. If an insurer falls short of that number, it owes its customers a rebate check. In 2025 alone, insurers sent out $1.6 billion in rebates nationwide for missing that bar, bringing the total handed back since the rule began in 2012 to roughly $14.3 billion. On paper, that looks like a hard ceiling on what an insurance company can pocket. United Health itself reported a medical care ratio just under 90% in its 2025 filings, meaning, by the company's own accounting, it was already running close to the edge of what regulators require. But look closer at what this rule actually caps. It doesn't cap your premium. It caps the insurer's cut as a percentage of your premium, which means when premiums go up, the dollar amount an insurer is legally allowed to keep goes up right along with them, without denying a single extra claim to make it happen. Here's the math. Take a large group plan priced at $1,000 a month. Under the 85% rule, the insurer can legally keep up to $150 a month in overhead and profit. Now raise that same plan to $1,200 a month, which is roughly the scale of what's happened to family premiums over the last 5 years, and the insurer's legal cut rises to $180 a month. Same rule, same 15%, 40% more dollars sitting in their pocket just by riding the price of healthcare upward instead of fighting it. Run the same math on an individual marketplace plan at the 80% tier. A $400 a month plan caps the insurer's cut at $80. Push that plan to $500 a month, and the legal cut climbs to $100, a 25% raise, again, without a single additional dollar of value delivered to the person paying for it. A rule that was designed to cap insurer profit ends up quietly rewarding insurers for doing nothing to slow rising costs, because their allowed slice grows automatically with the size of the pie. Now, here's where the real money shows up, and it has almost nothing to do with that percentage. Employer plans, which cover most of that $26,993 a year family, aren't required to publicly report how often they deny claims. That's part of why insurance feels like a black box in the first place. But the individual marketplace is required to disclose it, and it's the closest thing we have to hard, granular numbers on how this actually plays out. Every year, the Kaiser Family Foundation studies how often insurers on the ACA marketplace deny in-network claims. In both 2023 and 2024, the national average landed in almost exactly the same place, close to 1 in 5 in-network claims denied, right in line with what insured Americans overall report experiencing. Some insurers ran far above that number. UnitedHealth's own marketplace plans denied roughly a third of in-network claims across the 20 states KFF tracked in 2023, one of the highest rates of any major national insurer that year, behind only a regional Blue Cross plan in Alabama. By 2024, that same figure had fallen sharply, down close to the industry average, a reminder that these denial rates aren't fixed facts about a company. They're dials insurers can and do turn. And the reasons behind most denials aren't what you'd probably guess. According to KFF's data, lack of medical necessity, the reason people picture when they hear denied, accounts for only around 5 to 6% of all denials. Roughly 13 to 14% get marked as an excluded service, and another 9% get denied for missing a prior authorization or referral, paperwork problems, not clinical ones. But the two single biggest categories are vague administrative reasons and an unlisted other, which together make up well over half of every denial issued industry-wide. In other words, most of the time nobody is even claiming your care wasn't necessary. It's simply being filed away as other and left there. Here's the number that actually explains why this keeps happening. Fewer than 1% of denied claims are ever appealed. To put that in real terms, healthcare.gov marketplace insurers denied about 85 million in-network claims in 2024. Out of all of those, roughly 263,000 were appealed. That's a fraction of 1%. Most people just accept the denial, pay out of pocket, or quietly go without the care they were told wasn't covered. And for the small sliver of people who do file an appeal, insurers upheld their own original decision on about 2/3 of those appeals. The dispute process exists on paper, and technically it works exactly as designed. In practice, almost nobody uses it, and when they do, the house still wins most of the hands. A denied claim costs the insurer almost nothing in real pushback, which means financially, denying first and dealing with the rare complaint later is simply the rational move, every single time, at scale, across tens of millions of claims a year. And the newest money in this industry isn't even sitting inside the part of the business the 80/20 rule was built to govern. Look inside UnitedHealth's own 2025 numbers and you'll find Optum Rx, the company's pharmacy benefit manager, operating almost as its own separate empire next to the insurance book. On its own, Optum Rx pulled in $154.7 billion in revenue in 2025, up 16% for the year, even while the core insurance business was struggling through its worst year since 2018. A pharmacy benefit manager isn't your health plan. It's the middleman that sits between you, your pharmacy, and the drug manufacturer, negotiating prices and collecting a cut at nearly every step of that chain, largely outside the ratio that's supposed to keep insurer profit in check. The industry didn't need to break the 80/20 rule to keep growing. It just built entire new businesses standing right next to it, on the other side of the line the regulation draws. So the next time your renewal notice lands at something close to $26,993 a year, or a claim comes back denied with 3 lines of boilerplate and no real explanation attached, you'll know exactly what you're looking at. It isn't a mistake, and it isn't personal. It's the predictable output of a business that is legally permitted to grow its profit in real dollars every single time your premium climbs, that denies roughly a fifth of the marketplace claims it's required to disclose, and that has quietly built its fastest growing profit centers on the other side of the one rule meant to keep it honest. None of that requires a conspiracy. It just requires almost all of us to do exactly what the data says we do: pay the premium, accept the denial, and never file the appeal. That's not a flaw in the system. For the people running it, that's the whole system working exactly as designed. If you want the next one of these, where we crack open an entire industry and show you exactly where the money actually goes, subscribe, because we're just getting started.